Hello, you're welcome to Little Angel's Corner, your favorite channel for pediatricians approved tips on how to nurse your little one from birth till 10 years and beyond. My name is Dr. Stella. On this channel, I'm going to be giving you the exact tips you need as a mother so that you're able to nurture your babies without worrying too much. And we're going to do it together as a community until your baby is 10 years or even beyond. So today we're going to be talking about one of the common topics that bothers young mothers a lot. We're going to be talking about infantile colic. What is infantile colic? When you see your baby fretting, crying excessively, especially at night for 3 hours or more, and usually for 3 days, and up to 3 weeks in a month, um, we usually adduce it to infantile colic. And this usually happens in a baby that is otherwise healthy. That is, there is no accompanying fever, diarrhea, or vomiting. So if your baby has this little problem, what do you do? And usually the problem is worse at night when everybody is sleeping and the mom too would like to catch some sleep. That is when this colic seems to be at its peak. Before we continue, I'm sure you'd like to ask what causes this colic in the first place. There are various schools of thought about the cause of this abdominal colic, but the commonest is swallowed air in the baby's gastrointestinal tract, i.e., the GIT. So, what this swallowed air does is that as it is passing through the gastrointestinal tract, it causes the muscles to go into spasm and therefore the colic that we talk about. And then, secondly, some schools of thought adduce it to immaturity of the GIT. The baby is trying to transit from what he was in the womb to the outside world. So the gastrointestinal tract is still trying to adjust and mature to meet the new environment. Usually in the womb, the mother's nutrients takes care of the baby. But when the baby is now in the external world, the baby has to feed. So this adaptation has also been said to be a cause of abdominal colic. And then finally, some schools of thought will say that it's because in the womb, the gut is sterile in the baby. But when the baby is born outside to the outside world and starts ingesting milk, whether formula or the mother's milk, some bacteria are introduced in the process. So baby is trying to handle all that. All in all, how does this baby with abdominal colic present? The baby is all cranky. The baby is crying unconsolably, even after feeding, changing the diapers. There's still continuous incessant crying that can be traced to any other cause. And then you see the baby all cranked up. Sometimes baby doubles up, and you see the fists are clenched, and the baby is yelling at the top of his voice. It can be a situation that can bother most parents. So, what do you do? How do you try to console this baby as much as you can? It's a very tricky situation and very upsetting for the mom. Like I said, it works at night. And then the mom is usually worried. She doesn't want to wake the neighbors and other members of the family. So let me give you some useful tips that can help to reduce baby's crankiness and bring some comfort to both mother and baby. If you can remember, I said that air in the gastrointestinal tract is a common culprit of this. So when the baby has been fed, either bottle fed or breastfed, although breastfeeding is recommended better, what you do is that you put the baby on the shoulder, allow the baby to stay on the shoulder until he burps, until baby brings up gas, brings up air. Put the baby and leave the baby there until he has burped, and just continue to rub the back until the baby burps. You may have to do that right up till baby is there for about 30 minutes, maybe on the mother's shoulder for up to 30 minutes before he can belch. It's important that you leave the baby there. Another way to do this, after you've left the baby there for about 10 minutes and baby still hasn't belched, what you can do, put the baby on your laps with the tummy down, continuously rub the back until the baby burps. It's called tummy time. Baby may be on the mother's laps for as long as 30 minutes. Sometimes another way of reducing this abdominal colic or infantile colic, they mean the same thing, is make sure baby is in a quiet, darkened room, put on some music for the baby, and it seems to suit the baby. After some time, baby will sleep off. And so, what are the ways to prevent this? I think I've already spoken about making sure that the baby latches on very well onto the breast. For babies that are bottle fed, see that the baby does not suck the entire contents of the feeding bottle. See that when it's almost empty, before the last bit that the baby swallows, see that the baby is removed from the feeding bottle so that the baby does not swallow a lot of gas. And like I've said, after breastfeeding, see that you burp the baby until the baby releases air. So if all these measures have been taken and baby is still cranky, has a fever, probably vomiting, and some other signs that shouldn't be there in an otherwise well child, it's time to seek medical advice. It's best to take the baby to see his or her pediatrician. And like I've told you, this abdominal colic usually manifests in the starting from the first 2 weeks of life right up till about 3 months. Is a physiologic process. So by 3 months, baby should have outgrown this. So there is no need to fret. Just know that it's a process that will eventually go away. Therefore, mothers, I'm advising you to be calm and do not get too upset. And before we go, there's this advice I must give you, mothers. Do not, on any occasion, try to give your babies what we call drugs for this abdominal colic. Some friends and mother-in-law will tell you, give them drugs, it helps, either herbal or otherwise. Please don't give any drugs. Because most of these drugs are what we call antispasmodics. That is, they reduce the intestinal motility, and in the process, they may cause complete obstruction, that is, intestinal movement of the abdominal muscles, the muscles of the gastrointestinal tract. So please do not give it. Don't give any medications. They cause more harm than good. With time, this abdominal colic goes away. It's a physiologic process. It will reduce and eventually burn out. It's on its own. Yes. So I hope I've been able to reassure you, mothers, at least to a large extent, to let you know that infantile colic goes away with time. There are a few maneuvers you can do to reduce it in babies, and do not give drugs. So, mothers, if you found this clip helpful, please like, share, and subscribe so that it can get to other mothers. Please, I want us as a community to be able to grow and let more mothers join this channel so that together we can grow a community with the aim of having babies and children that are healthy and bright. Thank you. Bye bye. If you have any questions, please put in the comment section. I'll see you in my next video. Bye bye.